Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
You ask the patient if they can move their feet. You ask them if they can feel your touch. You ask if they have any pain in their neck or back. But exactly what are you assessing? Today we're talking about the anatomy of the spine because before we can understand spinal injuries, we need to first understand the structure we're trying to protect. The spine, also known as the vertebral column, is a flexible column of bones that run from the base of the skull to the pelvis. Its two major roles are to support the body and protect the spinal cord. The spine is made up of 33 bones called vertebrae, and each divided into 5 regions. 7 cervical vertebrae in the neck, 12 thoracic vertebrae in the chest, 5 lumbar vertebrae in the lower back, 5 fused sacral vertebrae, and 4 fused coccygeal vertebrae, which forms the coccyx, or as we call the tailbone. Between most vertebrae are intervertebral discs. These act as shock absorbers, allowing movement while helping to distribute forces through the spine. Running through the center of the vertebrae is the spinal canal, which contains the spinal cord. The spinal cord is the bundle of nerve tissue that carries messages between the brain and the rest of the body. Nerves leave the spinal cord at different levels of the spine to control movement, sensation, and many of the body's automatic functions. The cervical spine controls many functions involving the arms, hands, breathing, muscles, and even the diaphragm. The thoracic spine supplies the chest and trunk. The lumbar spine controls much of the legs and lower body. So damage to the spinal cord can interrupt these messages and may result in pain, numbness, weakness, paralysis, or loss or altered sensation below the level of injury. This is why spinal injuries have such serious consequences. Now, as first aiders, it's our role not to diagnose spinal injuries, but understanding the anatomy, it helps us understand why careful assessment and patient handling are so important, because the spine isn't simply a stack of bones. It's the body's communication highway, and protecting it helps protect everything below it.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.